The sunshine vitamin essential for life. Vitamin D is crucial for overall health and well-being. It plays a vital role in many bodily functions from strengthening bones to boosting the immune system. Unlike other vitamins, vitamin D acts more like a hormone, regulating various processes within our bodies. Maintaining adequate vitamin D levels is essential throughout life, from childhood to adulthood. Deficiency in vitamin D can lead to a range of health issues, while excessive intake can also be harmful. Understanding the importance of vitamin D, its sources and potential risks is key to making informed decisions about your health. This essay will delve into the world of vitamin D, providing you with the knowledge to prioritize your well-being. Understanding vitamin D more than just a vitamin. Vitamin D is often referred to as the sunshine vitamin because our bodies produce it in response to sunlight. But there's so much more to this essential nutrient than meets the eye. Vitamin D is a fat-soluble vitamin that exists in two primary forms, D2, or ergocalciferol, and D3, or cholecalciferol. These forms are not just different in name, they also differ in their sources and how they are metabolized in the body. Vitamin D2 is produced by plants in response to ultraviolet or UV radiation, and is found in some fortified foods. This form is commonly added to foods like cereals and plant-based milk alternatives to help boost their nutritional value. Vitamin D3, on the other hand, is synthesized by our skin when exposed to sunlight. This is why spending time outdoors is often recommended for maintaining adequate vitamin D levels. Both D2 and D3 are biologically inactive and require conversion in the body to their active form, calcitriol. This conversion is a two-step process that involves both the liver and the kidneys. This conversion process begins in the liver, where vitamin D is converted to calcidiol, and is completed in the kidneys, where it is finally converted to calcitriol, the active form. Calcitriol, the active form of vitamin D, acts as a hormone, regulating calcium and phosphorus levels in the blood. This regulation is crucial for many bodily functions, including bone health and immune system support. It achieves this by promoting calcium absorption from the gut, reducing calcium excretion by the kidneys, and mobilizing calcium from bones when needed. This ensures that our body has a steady supply of calcium for various functions. This intricate process highlights the crucial role vitamin D plays in maintaining bone health. Without sufficient vitamin D, our bones can become brittle and weak, leading to conditions like osteoporosis. Vitamin D's role in the body building bones and boosting immunity. Vitamin D is best known for its role in bone health. It is a fat-soluble vitamin that our bodies can produce when exposed to sunlight. However, many people do not get enough sun exposure, especially in the winter months, making supplementation important. It facilitates the absorption of calcium, a mineral essential for strong bones and teeth. Without sufficient vitamin D, our bodies cannot absorb calcium effectively, leading to weaker bones and an increased risk of fractures. Adequate vitamin D levels are crucial during childhood and adolescence when bones are rapidly growing. During these formative years, ensuring proper vitamin D intake can set the foundation for a lifetime of healthy bones. In adults, vitamin D helps maintain bone density and prevent osteoporosis, a condition characterized by weak and brittle bones. This is particularly important for postmenopausal women and the elderly, who are at higher risk for bone density loss. Beyond bone health, vitamin D plays a vital role in immune function. It helps the immune system fight off harmful bacteria and viruses, reducing the risk of infections. It helps regulate immune responses, enhancing the body's defense against infections. This regulation is crucial for preventing overactive immune responses that can lead to autoimmune diseases. Studies have shown a link between vitamin D deficiency and an increased risk of respiratory infections, including colds and the flu. Ensuring adequate vitamin D levels can help reduce the frequency and severity of these infections. Moreover, vitamin D is believed to play a role in regulating inflammation and protecting against chronic diseases such as heart disease, type 2 diabetes, and certain types of cancer. By maintaining optimal vitamin D levels, we can support overall health and well-being. Meeting your needs. How much vitamin D do you need? The recommended daily intake of vitamin D varies depending on age, skin color, and sun exposure. For most adults, the recommended daily allowance, or RDA, is 600 international units, or IU, while older adults, 70 years and above, need 800 IU. Infants require 400 IU daily. Sunlight is the most natural and efficient source of vitamin D. Exposing your skin to sunlight, specifically UVB rays for a short period daily, can significantly contribute to your vitamin D needs. However, the amount of sunlight needed varies depending on factors like skin color, time of day, and season. Dietary sources of vitamin D include fatty fish such as salmon, tuna, and mackerel, egg yolks, and fortified foods like milk, orange juice, and cereals. Section 5. The dark side of deficiency, vitamin D shortfalls and your health. Vitamin D is often called the sunshine vitamin because our bodies produce it in response to sunlight. However, many people don't get enough sun exposure, leading to a deficiency. Vitamin D deficiency is a common health concern worldwide, affecting people of all ages. It is estimated that over 1 billion people globally have low levels of vitamin D in their blood. Deficiency occurs when the body doesn't have enough vitamin D to function properly. This vitamin is crucial for maintaining healthy bones and supporting the immune system. Symptoms of vitamin D deficiency can be subtle and often go unnoticed in the early stages. They may include fatigue, which can affect daily activities and overall quality of life, muscle weakness, bone pain, and general discomfort. These symptoms can be mistaken for other health issues, making it important to get a proper diagnosis and increased susceptibility to infections. A weakened immune system can lead to more frequent colds and other illnesses. Certain groups are at higher risk of vitamin D deficiency, including individuals with limited sun exposure, darker skin pigmentation, older adults, and those who spend most of their time indoors. Infants who are exclusively breastfed may also be at risk, as breast milk alone may not provide sufficient vitamin D, and individuals with malabsorption disorders such as celiac disease or Crohn's disease. These conditions can interfere with the body's ability to absorb vitamin D from food. Untreated vitamin D deficiency can lead to serious health problems, including rickets in children, which is characterized by soft and weak bones, leading to skeletal deformities, and osteomalacia in adults, which is the softening of the bones. This condition can cause severe bone pain and muscle weakness. Regular checkups and blood tests can help diagnose vitamin D deficiency early, allowing for timely treatment and prevention of these serious health issues. Section 6. Too much of a good thing, the risks of excessive vitamin D. While vitamin D is essential for health, excessive intake can be harmful. Hypervitaminosis D, a condition characterized by high levels of vitamin D in the blood, can occur due to excessive supplementation. Symptoms of hypervitaminosis D include nausea, vomiting, loss of appetite, constipation, weakness, and confusion. The most serious complication of excessive vitamin D intake is hypercalcemia, a condition marked by elevated calcium levels in the blood. Hypercalcemia can lead to a range of health problems, including kidney stones, kidney damage, bone pain, and in severe cases, cardiac arrhythmias. It's crucial to consult with a healthcare professional before starting any vitamin D supplements to determine the appropriate dosage based on individual needs and health status. Section 7. Personalized approach, why consulting your doctor matters. Because vitamin D levels can vary greatly depending on factors such as sun exposure, diet, and overall health, a one-size-fits-all approach to supplementation is not recommended. Consulting with your healthcare professional is crucial to determine if you need a vitamin D supplement, and if so, what dosage is appropriate for you. Your doctor can order a simple blood test to measure your vitamin D levels. This test, called a 25-hydroxyvitamin D test, is the most accurate way to assess your vitamin D status. Based on the results, your doctor can recommend the appropriate course of action, which may involve lifestyle modifications such as increased sun exposure or dietary changes or vitamin D supplementation. Section 8. Striking a balance. Tips for maintaining healthy vitamin D levels. Maintaining adequate vitamin D levels is essential for overall health, and there are several ways to achieve this safely and effectively. First and foremost, try to get some sun exposure daily. Aim for 10 to 15 minutes of sunlight on your face, arms, and hands without sunscreen during peak hours between 10 a.m. and 3 p.m. when the sun's rays are strongest. Incorporate vitamin D-rich foods into your diet. Fatty fish like salmon, tuna, and mackerel are excellent sources, as are egg yolks and fortified foods like milk and cereals. If you're concerned about your vitamin D intake or at risk of deficiency, talk to your doctor about whether a supplement is right for you. They can help determine the appropriate dosage based on your individual needs. Section 9. Your health, your choice. Empowering yourself with knowledge. Vitamin D plays a vital role in maintaining optimal health, contributing to strong bones, a robust immune system, and protection against chronic diseases. Understanding the importance of vitamin D, its sources and potential risks associated with both deficiency and excessive intake, is crucial for making informed decisions about your well-being. Remember, while this essay provides valuable information, it's not a substitute for personalized medical advice. If you have concerns about your vitamin D levels or overall health, consult with your healthcare professional. By staying informed and working together with your doctor, you can make choices that support your long-term health and well-being.